Yes, ma'am.
Uh, I often miss committee members raising their hands while I'm on an item. If you could help me before I finish an item, just flag to me or let me know that a committee member has their hand up. I want to make sure I'm not gliding past anyone.
Absolutely. And your clerk today will be Dave Leon.
Then all of that to Dave.
Yes. We'll
Thanks,
keep an
Jill.
eye out for you.
Okay, I really appreciate it. Thank you both.
I heard my name. Somebody need something?
Dave?
Yes.
Yes, Supervisor Ellenberg asked if you could flag her for committee members raising their hands.
Yes, I can absolutely do that. Thank you.
Thank you very much, Dave.
Good afternoon, Dr. Day.
Hello.
We can hear you. Thank you.
Thank you.
Good afternoon, Michelle.
Good afternoon. Can you hear me?
Loud and clear. Thank you. And Kavita, oh, she's still connecting. Good afternoon, Miguel and Kavita.
Good afternoon.
Hey, good afternoon, Jill.
Loud and clear. Thank you. Have a great meeting.
There's our fearless leader.
Good afternoon, Vice Chairperson Wasserman. And you are muted, sir.
Yes, ma'am. There I go. I said, hi, Madam Vice President. All right.
Hey, Mike, it's 1:58. We'll start promptly at 2.
Sounds like a plan. You know, it's funny, Frontier Communications out in front of my house right now, about 15 feet away, adding a cable this big for 5G onto the existing wires that run across my house. And I said, how come you guys don't have to put this stuff underground? And they go, well, it's a telephone pole. We put this up here, and yet on the house I'm building, I have to go under curbs, replace curb, sidewalk, and gutter to run a wire this big for 12 feet. Little double standard there. There you go. Boom, boom. Could you hear that horn?
I did hear the horn.
Yeah?
Yep.
I'll make sure and mute as much as I can. 2 o'clock, I'll mute.
Yep.
Recording in progress.
It is 2 o'clock on September 2nd, and I'm calling the meeting of the Public Safety and Justice Committee to order. And let's begin with a roll call.
Good afternoon, Vice Chairperson Wasserman.
Here.
And Chairperson Ellenberg.
And here as well.
Thank you. You have a quorum.
Thank you. And do we have any speakers for public comment today?
We do have one public speaker.
All right, if anyone else wishes to speak during public comment on items not on the agenda, but within the purview of this committee, please go ahead and raise your virtual hand right now. And it looks like we are able to do 3 minutes today.
All right, one moment, please, while we get the timer up. The next speaker is Scott Largent. I'm unmuting you. Please accept the unmute. You will have 3 minutes to speak. The timer will start when you begin speaking.
Good afternoon, everyone. Scott Largent. Sorry if I kind of sound a little off today. I didn't have time to take lunch, and I've been busy kind of filming and interacting with some homeless sweeps. So I do apologize if I'm kind of off the mark right here. It might be time to take a break and eat. I was out at the component in First Street. Today was the final day in a way before they completely shut that down. I was thrown off the property actually several times. What I was trying to do, there were several war veterans that were out there that did not get a hotel room. They didn't get their vehicles repaired. And, you know, I mean, if it's going to turn into a trespassing charge, that's what it's going to be. Somebody's got to stand up for these people. Now, I understand that we have Home First. I nicknamed them Home Last, that it was kind of like took the reins on this one. Apple, I believe, kicked out about 2.5 million, then increased it to 3.5 million. And, you know, being a previous business owner, I get what they're doing, and I get how the administrator is going to make big dough off of this thing. They were supposed to have this mystery mechanic. Now, he only surfaced, I believe, for a half an hour. And they had made promises to people, kind of get them on their way. Hey, we'll put, you know, water this, we'll, you know, tune up, check things out. Just kind of do the basics to get people on their way. It did not happen. There's a gentleman out there. It's very, very sad. He actually had a nice motorhome. He was rushing. He only had a couple more days to get it out of there. You know, he works. He has his construction truck, his regular Audi that he had. And he was trying to get it started. It had a gas leak. Basically, long story short, the thing burned to a crisp, burned to the ground. And if there was a mechanic like Home First had promised these people, this man would still have a home. Okay, and it was very sad to watch the final bit of his charred out belongings get thrown into a dumpster out there today. There was another man out there today that was walking around with one of those half-cut samurai swords. Okay, that man needed mental health services a long time ago. Okay, and they keep pushing it off and saying that, you know, Home First was supposed to notify people. They didn't. I'm surprised they didn't shoot and kill this guy in the middle of the road out there today. No behavioral health, no crisis intervention, no nothing for this man. You guys already know I talk a lot of smack in a way about our system. I'm pretty amazed that these people didn't get the proper help. They got thrown into hotel rooms, but they paired them up. They threw them in these hotel rooms that were drug dens, and they're really not going to have a chance. And this is the same thing that they're planning now out at Spring Street. They're going to go in a 3-stage cleanup, and it's going to all end up in the front of your county building, and it's going to be just a disaster right now. So people have been waving the flag for a long time, and this is pretty amazing. Thank you.
Next speaker is Jose Valle. I am unmuting you. Please accept the unmute. You will have 3 minutes to speak. The timer will start when you begin speaking.
Hi, this is Jose Valle with Silicon Valley Debug, Care First, Jail Last. I'm speaking on item number 5 and agree with the EMC and Burns Institute preliminary findings that the community has overwhelmingly decided we do not want a new jail. It's time to reimagine the justice system as a whole, address the root causes of incarceration, and have alternatives. We are looking forward to the Burns Institute's community engagement process with folks in the county jail. Strongly support someone who is system impacted to help facilitate and recommend focus groups to be inclusive of all jail populations and classifications. Thank you for your time.
Our next speaker is B. Beekman. I am unmuting. Sorry, go ahead, Chairperson.
Sorry, before
Yes.
you start. Jose, thanks. We're in public comment. That was on item 5. Glad to hear the feedback, but I just want to make sure that you don't repeat that when we do get to item 5. If you can't stay for the whole meeting, of course, I understand, and thanks for speaking up at your own convenience.
Our next speaker is B. Beekman. I am unmuting you. Please accept the unmute. You'll have 3 minutes to speak. The timer will start when you begin speaking.
Hi, Blair Beekman here. I hope it can be somewhat fairly appropriate at this time. I just wanted to thank yourselves for the efforts in trying to address the Sheriff Lori Smith issue and the actions you've chosen towards this effort. It's uncomfortable, but it's my feeling, you know, with the underlying issues of HTA and say the Gilroy shootings of the past few years, we're really trying to readdress some really serious bureaucratic issues within the Sheriff's Department. I mean, it's taking a wide range of issues that include the OIR process that she's described as being able to agree to some parts of its process, but the OIR people themselves have been here on public comment time recently to describe that they're not getting another half of information that's very valuable and needed to them, that Sheriff Smith is still not delivering. And that I've tried to offer continuously that the surveillance and technology ordinance ideas can, you know, be a way to create good examples of how to create that feeling of openness and guidelines towards good sharing and good practices that can help make the process easier, how you can actually start to deliver those, Sheriff Smith can deliver those things that the OIR needs at this time and to break the ice. Good luck in those efforts. And I was also trying to say recently that it's not just the, for as much as important it is to work on these issues with Sheriff Smith on a wide range of things, there's a bureaucratic practice within San Jose, within Santa Clara County government and within local Santa Clara County governments that we have to really reevaluate our bureaucratic practices there as well. You're doing some great committee work. Thank you. It's me. I'm considering the ideas of it sounds really stupid now. I'll think of a better phrase for it in the future. Person to person, heart to heart communication with each other. We have to develop those skills better. And I for all the great new groups you'll be starting up, which are important, it is that communication we got to have with each other and learn how to do that better. That can help our bureaucratic future and just better practices for all of us. Good luck in those efforts, peace, good democracy, and good luck with the COVID issues. I hope that we're at a time to start to readdress you know, the vaccine process, the vaccine passport process. There are ways to make that safe for everyone, and everyone can feel their needs are being met. You know, through weekly tests and that sort of thing. It's that creative effort. Good luck how we can do that too. Thanks.
That concludes our request to speak.
Thank you so much, Dave. That moves us to the consent calendar. And Supervisor Wasserman, I'd like to add item 7 to consent. This is a report from the Social Services Agency, Department of Family and Children's Services, Behavioral Health Services Department, Public Health Department, and Probation Department relating to psychotropic medication use amongst foster care youth. I will make that a motion, and Supervisor Wasserman, if you would like to second that, second approving the consent calendar with item 7, item 10, and item 11.
What she said. Thank you.
Outstanding. Let's have a roll call. Oh, that's, are there any speakers on the consent calendar?
We have no speakers on this item, Madam Chair.
All right, let's do a vote.
Vice Chairperson Wasserman?
Yes.
Chairperson Ellenberg?
Yes.
Thank you.
Thank you very much. That moves us on to item 4, which is to receive verbal reports from select departments on their ongoing response to COVID.
Thank you, Supervisor. This is Gary Hersig, Deputy County Executive. And as we did last month, we'll be focusing on first a report from the court regarding delays caused by COVID, as well as the departments that oversee custodial settings. So with that, I see Judge McGowan on. We'll go ahead and kick it off with the court.
Thank you. Yes, it's Judge McGowan filling in for Judge Zahner. We currently have 420 time not waived trials that are backlogged due to COVID. Of those 420, 320 involve out of custody misdemeanor cases. Of the 100 that remain, approximately 50% of those are out of custody felony cases. Prior to COVID, the court was running 41 criminal departments and 3 additional departments in juvenile justice that might involve in custody juveniles. Currently, the court is running 30 criminal departments and 2 juvenile justice departments. The court also is currently experiencing 9 judicial vacancies, which of course means we are down 9 judges. And that completes the report from the court.
Supervisor Wasserman, do you have any questions on this first report? Please go ahead.
Thank you very much. And Madam Chair, if you'll allow me to do so, what I wanted to do was share these prepared comments with Judge McGowan to share with Judge Zahner. And it simply relates to the court. So Madam Chair, I think this is the appropriate time as compared to item number 9 that I read these 3 or 4 sentences, if you'll indulge me.
Go right ahead, please.
Thank you. Judge McGowan, thank you for filling in for presiding Judge Zahner. What I'm sharing with you now is just to let you know that Supervisor Simidian and I are planning to put a referral into the hopper for our next board meeting on September 14th in a couple of weeks, asking someone from the court to come to our Board of Soup meeting on October 5th and give our entire board an update on court operations. Not just what's open and closed and what the schedule for reopening looks like, but other existing issues as well. Things like staffing, the court's ability to respond to public inquiries, whether about jury duty or appearing in court or anything else. So Judge McGowan, it's really just kind of an expansion on what you just presented now, and to have someone from the court there able to answer any questions that may come from the board.
Thank you. I'm happy to forward that information on to Ted Zahner.
Thank you. And it's just a heads up and a 1-month advance notice. Thank you. Thank you, Madam Chair.
Thank you. Gary, who's next?
We'll move to the Sheriff's Department next.
Thank you. We'll introduce Sergeant Menchaca, who can give a brief update.
Good afternoon, Supervisors Ellenberg and Washman. Currently, the Sheriff's Office has 5 COVID-19 positive employees and 19 COVID positive inmates in our care. As far as our vaccine numbers, we are at 79% of our Sheriff's Office staff that is vaccinated to date. And that concludes my report.
Thank you so much. Really glad to hear those numbers going up. I did want to ask a couple of questions about the COVID outbreaks and how those actually impact what's happening in custody. So first, have any of the in-person components that have been returning to normal, such as visits and programming, remained intact for the population that has not tested positive?
And we'll ask Lieutenant Fernandez to talk about what's happening at the jail.
Great, thank you.
So currently, the only dorm that's restricted from social visits is 4A2, the dorm that had the outbreak. It has not impacted any other housing unit.
And when somebody does test positive, they're taken to that dorm?
No, so that was the dorm with the initial inmates tested positive. Once they test positive and they're confirmed, they're moved to a separate isolated dorm. It's a cohort for positive inmates. They're isolated from the general population. They're getting additional medical care and supervision, and they're separated, like I said, from the general population to minimize the spread.
And if I may add, also, I think it's important to note that it really is custody health that tells us where the person should be housed. And so I think that if you wanted further information on how that is being managed, custody health would be the group to give you a report.
Sure, thanks, Sheriff. I do have some questions for custody health as well, but I just want to make sure I'm clear here. When the people are separated, people who test positive, you said they're isolated with a cohort. So they're not isolated in cells by themselves. They're together with other folks who have tested positive. Is that correct?
That's correct. They are in a dorm that's cell housing as well, but they can be 2 inmates per bunk or per cell if necessary.
Got it. And when there is an outbreak, we're not suspending any of the in-person activities that the general general population has access to.
We are limiting social visits. If they're exposed, if they're high risk exposure, they're also limited to going to court. They can still go to court, but they're treated as individual out-alones to minimize the exposure.
And when people are coming to visit in person, is there a vaccine mandate for them or a negative test? Do they have to show anything to assure all of you that?
Is it all window?
Not at this time. And those are non-contact visits at the main jail.
But someone could come in and be infected.
Potentially they can. They are asked to, we have the same screening questions as we do for staff to self-monitor if they have any symptoms to report to staff.
Okay. Okay, great. I think, just check my list. I think that is it. Thank you so much. Supervisor Wasserman, any questions for the sheriff regarding COVID management?
Thank you. It's a generic question for all those presenting. What I've learned that is so difficult is that any of us can be infected and carriers and get infected, whether or not we've been vaccinated or not. And so I really appreciate all the detail and hard work each of your departments is doing, trying to keep people as safe as possible. Thank you.
Thanks. I obviously agree with the safety piece, and the companion to that is that because so many have been vaccinated and because we're hearing also that this may be with us for a long time, I think it's important to keep going with as many of our regular programs. Kids are back in school, in-person programming in custody, and really make sure that we aren't overreacting and shutting things down for folks that haven't been infected or tested positive during this time. So sounds like we are on the same page there. Thank you.
Yes, we are on the same page. And what I'm finding out is people who are vaccinated either don't get it or they get it with little to no side effects. But I worry so much about those people, Supervisor Ellenberg, that are not vaccinated.
Yep. Gary, who's next?
Thank you, Supervisor. Juvenile probation.
Good afternoon. If you all are well, I'm going to turn this over to Deputy Chief Nick Burchard to give an update on the institutions.
Good afternoon, everybody. Just a quick report that currently we have no youth at either of our facilities that are COVID positive. It's been quite some time, which is good news. And we currently have no staff that are positive. Actually, we have one staff that is positive at one of our facilities that did not have contact with the youth. So that's encouraging. So that's our COVID update. As we've reported on in the past, we are full education going on right now at both facilities where teachers are on site 5 days a week. So that's encouraging. Really excited. Maybe I shouldn't be, but I'm very, very happy that there's a mandate that all of our folks who are coming into custody services and all of our operations here in the county have to be vaccinated. So I think that over time that this is certainly going to help that process along for anyone who comes into a custodial setting or congregate care setting. So as we move forward with that, I'm hoping that those cases get smaller and smaller at all of our facilities. As far as the courts go, I know that Gary had brought up from the juvenile side, probation early on was able to set up remote communication for attorneys and in custody youth. And that continues for youth who may be quarantined when they first arrive and we're waiting for a COVID-19 positive or negative test. Youth who cannot be brought into the courtroom do have the ability to appear on their case remotely. So we set that up early on during COVID to make sure that youth were still able to participate in their court process even when they first came in, say to custody. Also, due to the Welfare and Institution Code's 827 court process, the backlog of petitions has been cleared so that any criminal case that had previously been delayed due to filings for confidential juvenile records can now move forward in a much timely manner. Overall, the courts and probation are satisfied with the pace of case resolution and has not heard of any complaints by other stakeholders at this time with our court process. So I think we've been pretty fortunate. We meet and have met frequently during this process to work out any issues that may come up And I think through the collaboration of all of our partners, we've been able to kind of at least continue with the court process and not have very, very long delays. So that's been very, very, very comforting to know that kids aren't here in custody for any longer than they have to be. That's my report, and I'll take questions if you have them.
Thanks, Nick. If kids are doing their court appearances virtually, do they still have in-person access to their public defenders and any of the other advocates who are working on their cases?
Yes, however they would like to do that. I see Sylvia shaking her head. So if a youth wants to communicate or their attorney wants to communicate in person, and we'll set that up so that it's safe. That can be done via Zoom as well. We've set that up so that it's confidential. Then they can have that time to meet with their attorney.
Sylvia, do you have a counterpoint?
No, I'm agreeing with Nick that I agree also with his assessment. It's worked out really well. I think they're doing a really nice balance between getting the client's needs met and meeting with them in person when necessary, but taking the precautions. So they're doing a really excellent job. I congratulate the probation department on that.
Yeah, thank you. And I think even the court, when the court lobby and making sure that there's enough space and making sure that victims and parents and whoever needs to come into court can, if they would like to do that remotely, they can. If they're in person, we make sure that everybody has enough space and that everyone's wearing a mask. So I think so far it's worked out very, very well for us so far. Knocking on wood.
Supervisor Wasserman?
No, ma'am, no questions. Good job, Nick.
Thank you.
All right. Thank you. Gary.
Let's move on to custody health.
Hey, good afternoon, supervisors. Custody Health Services, we continue to take aggressive efforts to mitigate COVID-19 in the congregate setting. We're spending substantial efforts in nursing time up to 21 hours a day to provide rapid cycle testing for vaccinated staff once a week and non-vaccinated staff daily. The pretrial, probation, custody bureau, contract staff, and healthcare staff. With our patients, we're continuing with asymptomatic testing and COVID-19 vaccinations as well. To date, for the last 18 months, we have provided 33,000 PCR tests with results. That's averaging about 1,800 PCR tests a month for asymptomatic surveillance testing with our patients. And as you know, we have had a breakthrough with some COVID in the congregate setting. We have to date 19 patients that are COVID positive. However, 3 of those were fully vaccinated. And so we did have breakthrough COVID with fully vaccinated patients. 1 was partially vaccinated, and then 5 others were unvaccinated. And so those patients, we're testing those patients. We're offering 0-day testing, the 4-day test, and then the 8-day test to continue to make sure that patients under exposure protocols are not coming down with COVID-19. We're also spending quite a bit of effort getting our vaccination uploaded to the vaccination cards for our staff uploaded. And so we have almost 90% of our healthcare staff that are fully vaccinated, and those others are getting being encouraged to vaccinate as per the August 20th and then September 31st date. I'll also mention that we do have dedicated nurses that are wholly charged with doing vaccination education, vaccination triage, and then patient consents. And they're running our vaccination clinics for our patients every week. And we just completed a COVID-19 vaccine incentive program with our patients. We did that in partnership with our custody bureau. And so we did what we called a COVID-19 perk pack of sort of goodies. And so that has increased our consents with other patients who are not fully vaccinated to choose to be vaccinated. So we're running a clinic both tomorrow and this weekend for those patients. And I'll take any questions that you might have.
Thanks so much, Dr. Day. Forgive me if you said it, I didn't hear the number. Currently, how many individuals are positive? And what is the breakdown between cases identified at booking versus in custody transmission?
I have to get those numbers exactly for this 9 cohort, but we have 19 that are positive today.
And that's 19 people who are in our custody, not custody staff.
That's correct.
And do you happen, I appreciated hearing about the breakthrough. Do you know of the custody staff who tested positive, were they vaccinated?
I think we had a couple that were vaccinated. I don't have those exact numbers for between Custody Bureau and Custody Health. but we have had some breakthrough with fully vaccinated staff as well.
Okay, if you could get that to us off agenda, it's just helpful when we're thinking about the whole picture of what's happening there to really understand the breakdowns. What are the current protocols for people that are in custody to limit transmission in the jail, of course, and promote health and safety? Do they get PPE, masks?
Oh, absolutely. And so, and part of what we're doing, very little of our protocols have changed, even with some of the public health recommendations. We're still wearing all of our universal precautions, the mask, the N95 upon request, but with certain areas like our infirmary, for instance, 8A, any of the clinics, those nursing staff and all staff that are involved with any patient encounters need to wear the full PPE. In some of those areas, that includes the shields and the full gowns. And so they have to don and doff all of those gowns, depending on where those patients are located. And so full universal precautions, hand washing, we're encouraging, masking 100% of the time when you're behind the perimeter. And so, and that includes in your office spaces. We're encouraging even in the office spaces. A lot of these areas are cubicle. And so folks still need to wear their masks during those times as well.
And the folks that are in custody?
Patients?
Yes.
And patients, we provide masks upon request, and so they're always encouraged to wear their mask. We cannot require that they wear masks, but we do make them available to them at any given point. If they ask for more, we make those available to them.
And if they're not patients, just people who are in the dorms or on whatever floor, are they able to access masks if they want them?
Oh, absolutely. We provide all masks.
Sorry. So sorry. I was actually back at my office, and then a couple people got sick, not COVID, but we decided to back it off a little bit.
Yeah, but we do provide masks, and we provide masks for anyone who needs a mask. So
thanks. With regard to specific treatment protocol that's used to care for people who test positive, are there any differences from how somebody would be treated in custody from how any other resident would be treated in our health and hospital system by VMC?
Absolutely not. And I will tell you, Supervisor Ellenberg, we have probably the most talented doctors who are very savvy with infectious disease and managing COVID-19. And we've been pretty sort of blessed, if you will. We have very aggressive protocols. These patients are monitored. They have the protocols on what they need as far as, depending on if they're asymptomatic and or having respiratory distress. We know at what point they need to go out if that's the case, but they all have medical oversight. They're being seen by the nursing up to 2 times a day, if not more. And so it's pretty impressive, the work that is being done with these patients.
That's great to hear. And just one final question. I realize that they are isolated from the general population, so wouldn't have access to in-person classes, but do they still have access to tablets, to reading material, to anything that would be available to them in the general population other than classes?
As far as non-contact groups from the healthcare side of the house, we can continue that. However, any tablets and or books and things, that comes on our custody bureau side of the house to provide in those housing areas.
Got it. And so then back to the sheriff briefly, for folks that are in under the observation or care of custody health, do they have access to tablets, books, whatever else they might, the things that they would be able to have access to in the general population areas?
Yes, we've moved staff from the table, but yes, they do have that access, of course.
Great. All right, thank you so much. Happy to, Supervisor Wasserman, questions?
Thank you. Yes, Dr. Day, why can't or don't we require masks of the patients?
We encourage them. However, we pretty much because they have a right not to wear the mask, and we encourage them, we make them available. And so our protocols are at certain points, especially if they're being transported, if they're going from their cells to an appointment, they are required to, we encourage them to wear masks. Some of them may take them off at different times, but it's hard to enforce a requirement, and that cannot be conditional on care.
wearing a mask cannot be conditional on care?
In this setting, that's correct.
Okay.
We cannot deny care if they are
Of course not.
masks. So.
I would never suggest denying care. I just thought we could certainly require that they wear a mask while in our custody. That's interesting. But you're saying they have a right not to wear a mask?
They can take those masks off, and we on the healthcare side of the house, we encourage and we provide the mask, as do our custody bureau colleagues. But we're not. We cannot require from the healthcare side of the house that they wear masks at all times.
Okay, even though we require that of our own employees.
Absolutely, that's correct.
Okay, thank you.
And we've had these discussions as well with our prison law office.
Yeah, good point. Thank you.
All right, we'll move to administrative booking, and pretrial will be reporting on that.
Sorry, just Gary, before they do that, I'm still just thinking about the 19 people in custody and wonder if I can just direct a question to the public defender. Molly, given that 19 people have tested positive so far, I'm wondering if any of them are public defender clients and whether their needs have been communicated to attorneys in your office that you think might be important to raise.
Hi, Supervisor Ellenberg. Thank you for the question. I did speak to your board aide, Layla, yesterday on this issue, and I sent out a request to our supervising attorneys to get information about known COVID positive clients. And I would like to report out at our next meeting and or get back to you offline, off agenda. But I did hear back from one lawyer who said that she had a client who was told he was will call, which I think is a separation before court, but hadn't been told kind of why that was. So that may have been an exposure. But I haven't gotten substantive information about public defender clients who are COVID positive since yesterday when I sent the email out. So I'm happy to circle back with more information. I just don't have any further to provide at this time.
Not a problem. That would be great. Thank you.
Okay.
And just,
Thank you.
You know, I of course talked a lot about this on Tuesday, but I just want to shine a light again on the fact that this issue of the outbreaks in custody really provide just another compelling reason for reducing the jail population. The congregate and non-voluntary nature of the jail, of course, contributes to the ease of transmission of all contagious diseases, COVID and otherwise. And if we could significantly limit the entrance of people who will only be in the jail for a few days at a time, we can really, I believe, significantly reduce the risk of transmission of disease for the people who are in custody for longer periods of time. And as the referral that I introduced with Supervisor Chavez to the board this past Tuesday reflected, I'm really looking forward to working with all of the departments across PSJC and the reentry network to continue to reduce the jail population as we move forward.
I couldn't agree with you more. Thank you.
I thought you might. Back to you, Gary. Apologies for the interruption.
No problem. We'll move to administrative booking, and reporting on that will be pretrial and Michaeline Reagan.
Hi, good afternoon. Thank you. Michaeline Reagan on behalf of Matthew Fisk. We are happy to report that admin booking is working 24/7 and providing all services at this time.
Thank you.
Woohoo.
That concludes the report, Supervisor.
Thank you so much to all of the departments, really continuing to pivot and adapt and be flexible as we go. I really am just impressed across the board. Do we have any public speakers on item 4?
We do have one public speaker on this item, Madam Chair.
Let's do 2 minutes, please.
All right, one moment, please, while we get the timer up. Our next speaker is Claire. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, good afternoon. My name is Claire Courtwright. I am an attorney with the Law Foundation of Silicon Valley. And we're just here to say, you know, the COVID-19 pandemic is not over in our state, in our county, or in our jail. New infection totals are higher every day, and vaccines are not a panacea. We're still learning about vaccine efficacy against Delta, and troublingly, 25% of the new infections in LA County were in fully vaccinated people. And once again, there's a COVID outbreak at the jail. The jail and the county have stonewalled Law Foundation for months and thrown out false excuses why they will not meet with us to work on conditions inside, including that the consent decree prevents it, although Prison Law Office has repeatedly told them it does not. There is no transparency from the jail with regards to COVID measures, and the jail needs to take concrete steps to address the policies and conditions that allow COVID to be introduced and to spread inside. We continue to hear about unsanitary and unsafe conditions in the jail that threaten the health and the lives of the people who are helpless there to protect themselves against this threat. Thank you.
Our next speaker is Scott Largent. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Thank you, everyone. I got a little distracted there for a second, but I believe we're still on the COVID item, so I don't think I'm off topic right here. What we're going to have happen over at the FAA crash zone, and of course with the Delta variant, raging out of control, is we're going to take 3 different sections of the largest homeless encampment basically in California. We're going to start with stage 1 over near Coleman and Heading right there, and basically push everybody into stage 2, which is right at Spring Street. And then we're going to follow with that, pushing them into stage 3 over near the creek and the freeway. That just doesn't seem like an appropriate thing to do right now. Even out at the Rotten Apple encampment, there were outbreaks of COVID. And what I found shocking is I was wondering where the health department was at, where the contact tracing people were at, where mental health, behavioral health. I'm very puzzled by these kinds of things. We're going to sandwich everyone together. These people, since we still shut off water, bathrooms, and basic, necessities in life, they're going to end up at the county building. That's the closest place where people can really go. So I mean, if that's what you guys want, that's what's going to happen. And you have to start giving people options. There's no safe parking programs. There's really nothing. Get on your own hotline. Contact the city's hotline. I was kind of upset when they came out and gave me a flyer, and I just said, look, what are the options? Nothing. There's no options for these people. So, and COVID's going to spread like wildfire there. It's just going to happen. So thank you, everyone.
The next speaker is B. Beekman. I'm unmuting you. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, to comment on the COVID situation in jails, and I'm sorry that this is happening. The vaccine process can actually help to lessen the effects of the COVID if you have it, but it's not very good at actually warding off the COVID itself. Good luck in your efforts. Good luck how we can better talk about the science of the vaccines, and possibly to learn to begin to talk more about the aerosol vaccine process and what that how that can actually be of help. And I think it can be something safe, and it can be a short-term remedy, hopefully, that I hope can be better talked about. To quickly also offer about the Columbus Park area, the city of Palo Alto, they've done some amazingly good work on the future of their homeless community and parking in cars on streets and parking lots. Please look into the work of Palo Alto and how that can help, the tow truck situation for the Columbus Park area, and that it isn't a serious tow truck issue. You don't have to bring in massive tow trucks and soften the San Jose tow truck policy there already. That would be a lot of help, and good luck with that issue. Thank you.
And that concludes our request to speak.
Thank you so much. We do not need a vote on that item, so we'll move on to agenda item 5, which is progress report on the community engagement process regarding a new jail.
Thank you very much. Are you able to hear me okay?
Sure can, Martha.
Great, thank you.
So we have, I'm excited about our presenters today. I'll be introducing them in a moment. So the presenters, I'm going to ask you to turn your cameras on for the introductions. So this is a preliminary report on the work done to date on community engagement related to the county's justice evolved clients. In March, we presented the board with a framework and next steps to support these clients. The three-part framework included additional efforts aimed at minimizing the need for incarceration, number two, expanding behavioral health services, and number three, developing a plan for decommissioning Main Jail North and older housing units in Elmwood to improve the living conditions and treatment for those clients. And so one piece of this was the conduction of a series of community engagement sessions. So I'm going to go ahead. As you know, the county contracted with Burns Institute and EMC Research to conduct these sessions, focus groups, and surveys. So I'm going to go ahead and introduce our presenters today. From the Burns Institute, we have Joanna Lowry and Manuel LaFontaine. And from EMC Research, we have Emily Kirby Goodman joining us, as well as Riley Jones and the CEO and President, Ruth Bernstein. As I mentioned, this is a preliminary report, and the final reports from EMC and Burns will be coming back to this committee next month before they go, and they'll go to the full board in November as part of the larger discussion on this three-part framework I just mentioned. And so with that, I'll go ahead and turn this over to Burns and EMC for their presentation.
Thank you, Martha. Good afternoon. My name is Manuel LaFontaine, and I'm a community engagement specialist with the W. Haywood Burns Institute. So the W. Burns Institute has 20 years of experience, right, working across the country to eliminate racial and ethnic disparities in the administration of justice. And we have evolved our thinking, our approach, and developed a framework that shifts our focus away from the traditional reforms as we work towards dismantling structural racism and build community-centered structural well-being that positions jurisdictions all over the country to achieve a greater degree of public safety.
Good afternoon. I'm Emily Goodman with EMC Research. We are a full-service opinion research firm serving state and local governments and nonprofit organizations and other public agencies across the country and a lot here in the Bay Area. We utilize in-depth academic understanding of research and an extensive real-world experience with our staff to inform policymakers and organizations about community attitudes on a wide range of topics. We're happy to be here with you today to share some of those preliminary research findings around public safety issues facing the county.
Great, thank you, Emily. So these findings that we're going to be highlighting within both we're highlighted within both Burns Institute's community engagement sessions and EMC's focus groups. And then later on, my colleague Joanna and Emily will continue to share our respective specific findings later on in our presentation. So as you will see, right, we had 2 virtual community engagement sessions that took place over Zoom. It was open to anybody in the community. We particularly focused our outreach to those that were directly impacted by the jails. We facilitated 2. It was one on a weekday on the evening on July 8th, and then on a weekend on a Saturday, July 10th in the afternoon. There were 180 participants, and we had both Spanish and Vietnamese translations available. We also had a recent in-person community engagement session that took place last Friday, where we had about 50 participants, also open to impact the community with anyone else that wanted to show up.
Great. Emily from EMC here. The findings that we're going to share today are from some focus groups that we did among the general population. We did 4 groups in total on July 21st and 22nd. They were conducted in English. We did them virtually online over Zoom. And the 4 groups consisted of high level or engaged folks around the county. We divided that by age, so over 55 and under 55. And then the second 2 groups we had were kind of the lower engagement or lower level of civic engagement, again, divided by age, so over 55 and under 55.
Emily, could you explain how high engagement was identified?
Sure. It was based on vote history, if they're voters. So if they, participated in, at least 2, 3, 4 of the last 6 elections or so, we used vote history. We also used kind of self-identified characteristics like show up to public meetings, engaged with your, representative, supervisor, things like that. So it was both self-ID and then based off of information if we had it on the voter file.
Thanks.
Okay, yeah. So as we go through these findings, we will try to be as clear as possible when we're referring to the community sessions and the focus groups with the general population. So we're all going to take turns going back and forth because, as you will see, we had some pretty shared findings among the various pockets of folks that we talk to. So we'll try to be very specific about what we're referencing, but if anything's unclear, please let us know. So I'll punt it back to Manuel to begin our overall findings.
Thank you, Emily. So again, right, the findings overall, you'll see the 5 findings came from both our focus groups, so EMC's focus groups and our community sessions. And then later on, we're going to go, my colleague Joanna will pick up the specific findings that came out of our sessions. So I think the most important thing to highlight was that participants emphasized the need to reimagine justice, moving away from putting people in jail in favor of preventative measures, alternatives to incarceration, and addressing the impact of structural racism. So for folks that attended the virtual community engagement sessions, it was an overwhelming representation to reinvest, right? For the need to reinvest in lower income communities and have this investment impact, the need to reduce jail populations. And so there'll be more examples later on in slide 9 that folks brought up at the actual sessions.
So in contrast to kind of how Burns Institute found, obviously folks that are very close to the issue saw the need to reimagine justice. Even the general population individuals that we spoke to that were admittedly much farther from the issue or said that they didn't really think about it, on a day-to-day basis, also still saw the need to reimagine justice, shifting away from putting people in jail where possible. They were sort of a little bit unclear on what that would look like, again, because they are farther from the issue, but they certainly saw the need to kind of think creatively about how to address the issue.
Thank you. So the second finding was that these forums that we were having, right, at least for us, for the Burns Institute, was more than just the specific space, right, around what to build in front that the board supervisors put in front of us, but that opinion was driven by current events happening outside the county that was much more bigger than, again, filling this vacant lot. So the majority of folks from the virtual community engagement sessions do not want the county to invest in a new facility. And there's a clear interest in reimagining justice as a whole and addressing the root cause of incarceration and exploring alternatives.
In the case of the general population focus groups and the participants that we spoke with, we mentioned that they didn't really have kind of a real awareness of what was going on because they weren't that close to the issue. They haven't really been following what has been happening with Main Jail South or even county jails more broadly, but they are very much aware of, the broader discussions happening nationally. So we had a number of participants bring up the murder of George Floyd and how they personally felt that was a turning point for the country, but even in some cases shared personal experience about how they started to think about the criminal justice system in a different way as a result of those broader conversations.
All right, good afternoon, everyone. I'm Joanna Lowry with the Burns Institute, doing a little handoff from my colleague Manuel. But our next common theme was around addressing mental health needs, both within the incarcerated population and in the county generally, was really highlighted as a clear priority. Within the virtual community engagement sessions, there were many individuals that really stressed the need for greater expansion of preventative mental health services, particularly those that are rooted in community, run by community-based organizations, and housing. And there is definitely an acknowledgement of the linkage between those two things. It was also highlighted the need for an end of criminalizing mental health crises, as that disproportionately impacts people of color. And also the development of front-end responses or continued expansion. I know there are some front-end responses within Santa Clara County to mental health crises that do not involve law enforcement. And there were also many individuals that asserted that jail is really not an effective place for mental health treatment and often leads to a decline in mental health.
For the general population focus groups, we also saw a very strong kind of, I guess, emphasis on the need for mental health and substance abuse. We saw people connecting, the need or challenges around mental health and substance abuse leading to criminal, behavior, and that dealing with the needs of individual people in terms of, their mental health challenges or their need for counseling and substance abuse treatment. We saw that people thought that dealing with those issues would be more effective than, just putting people in jail or some other kind of punitive punishment.
And our last common theme was, while there is a general aversion to rebuilding the jail, many expressed concern for unsafe and inhumane jail conditions. And this was certainly brought up within the virtual community engagement sessions. Many expressed concern, not just with the actual facilities, but with a culture of punishment within the facilities and inhumane treatment of those who are within. A small number did voice that they saw those unsafe jail conditions as a reason for a new replacement jail, but overwhelmingly, the vast majority of individuals that showed up to these virtual community engagement sessions really saw jail conditions as a reason for a broader justice transformation and really looking at alternatives to incarceration and moving past carceral models.
And in the general population focus groups, when we sort of presented, should we rebuild a jail? Folks were sort of like, well, what does that mean? What happened to the current jail? Does that mean there's overcrowding if we don't rebuild the jail? And so there was some, concern about what that would mean. And then kind of second to that, if there is going to be a jail, sort of how Joanna was mentioning in the community engagement sessions, people are really prioritizing, that it needs to be, a humane facility, and we need to, fix any poor living conditions for those who are incarcerated. But kind of circling back to what we have shared to date is that people feel, at least in the general population, very disconnected from the issue. And so they don't really have an understanding of what the current conditions are in the jail to warrant kind of an informed response about whether or not there is a need for a new facility. So just a couple of things specific to the general population focus groups that we didn't quite cover in our broad findings. We did see that the general population, the participants that we talked to, do see a need for systemic change and really emphasize the need for mental health and humane treatment. But again, they're very disconnected from the issue. And most of the people that we talked to appreciated being asked about the topic and were very engaged. They also felt that this topic was kind of beyond the scope of what they knew, what was going on. We mentioned kind of a lack of awareness about, the jail and the surrounding public safety issues. So anytime we brought up, a potential idea or alternative, we saw a lot of openness from the participants around, what could be an alternative. And related to that, we did see some frustration among some of the participants, feeling that they didn't really have the information about the issue in order to make a decision, and they really see it as a job of the county leaders to make a good decision on the issue. So while appreciating being asked, they did not feel that they were the ones that were sort of equipped to decide what happens next.
So in terms of the virtual community engagement sessions, as was mentioned, many of the participants that came had been directly impacted by the justice system, or had family members who had been incarcerated, or had been following the issues within the criminal justice system. And so had a lot more, I think, concrete ideas around systemic changes and alternatives. So some of those ideas that came forward in terms of what need to change within the system include bail reform, ending the criminalization of mental illness and homelessness, addressing over-policing, changing probation requirements, utilizing crisis teams rather than police, and connecting people to community-based pretrial services as well as diversion services, again, rooted in community. Some of the alternatives that came forth, so instead of building a new replacement jail, the idea of a wellness center, a sobering center, mental health facility, greater individualized case management, public service, therapy, restorative justice practices, and then also a greater investment on the front end in community and prevention that included ideas around housing, education, universal basic income, et cetera. Again, the vast majority that came were not in favor, in terms of the facility question, we're not in favor of building a new replacement jail, but instead investing that money into alternatives and into preventative measures. And then many also highlighted the need to really listen to those that are most impacted by incarceration, who have experienced incarceration themselves and that are also living with mental illness. And so next up for us, the Burns Institute will be conducting 4 focus groups with people who are currently incarcerated, utilizing Zoom for that. And then we'll also have around 150 surveys of individuals, both within Main Jail North and Elmwood. And then we also will have another in-person community session coming up towards the end of September, and hopefully within a facility that is in the community.
Next up for EMC research, we are going to conduct a general population survey that's representative of registered voters throughout the county. This will be a mixed mode survey that's offered in a variety of languages. We are planning for a sample size of 800 interviews, and we are close to being underway to begin interviewing here shortly. So happy to take questions.
I'll turn to Supervisor Wasserman first for questions, but I just want to make a quick overall statement that I have never seen 2 different contractors work so well together, and the juxtaposition of your reports and the comparison of populations was just an incredibly powerful and informative presentation. So thank you for that, and I'll come back with some specifics. Supervisor Wasserman.
Thank you. I agree with the observation of Chair Ellenberg working together and reaching different groups from different perspectives and your ongoing. It's no secret, I'm in favor of both a new jail and new mental health facility. These can be complementary, not conflicting buildings. There is no need to say either or. They are not mutually exclusive. I hope going forward in the questions that each of you asks of community members is included, would you like to see both? Do you think we should have a new jail to provide better services and accommodations for inmates? Do you think we should build a mental health facility, since there isn't one of any substantial size in Santa Clara County? My personal belief is that we need a jail and we need a mental health facility. And I'll just close, Chair Ellenberg, by saying the public needs to know this is not an either or question. I believe there's support out there for both. Thank you.
Thanks, Mike. Do any of our consultants want to address the way the questions have been asked? Has it been a choose column A or choose B or some other way?
Yeah, so on our surveys that will go out to those who are incarcerated, it does offer an option to circle all that apply. I will say, though, I do think there are many within community, particularly those who have been directly impacted, that would see it as a either or, and that it's not that it is mutually exclusive to move forward in terms of justice transformation, in terms of what we've been hearing so far. But yes, we are offering an option to circle all that apply.
Thank you. May I respond, Chair?
Of course.
Thank you. Thank you, Joanna, for that answer. As your survey found, a lot of people had no idea of the details of what it was that they were being asked about. They weren't informed enough. I do hope that I know I'm reiterating here, repeating, but I'll just say, there are some people, in my opinion, that I believe need to be in jail for public good. There is a large population that need mental health services. And for some reason, the discussion seems to be, no, let's build a mental health facility, not a jail. And that's why I expressed, I hope going forward, that the public understands, at least from my perspective, and I believe there's a few other supervisors that might agree, that we should try and do both. And the reason for the new jail, in my opinion, is because our existing jails, and I apologize for the pounding in the background, our existing jails are not right to live in. And we need a new jail that is more inmate friendly, accommodating, provides the space and the ability to rehabilitate. Everyone agrees that our jails are not in a condition in which people should be kept. I want a new jail so that we have appropriate accommodations for those people that should be in jail. At the same time, I really want a mental health facility because we have so many people in need of mental health services, and mentally ill people do not belong in jail. Thank you.
Chairperson Ellenberg, may I invite Emily from EMC to also answer Supervisor Wasserman's question?
Of course.
Yes, thank you, Martha. Supervisor Wasserman, I just wanted to acknowledge that we heard what you said and have incorporated the both option into the quantitative survey that will be representative of voters in the county.
Thank you very much. Thank you, Madam Chair.
Fantastic. Thanks. Emily, I appreciate your taking information and feedback here and incorporating it in the remaining part of your work. I want to just thank our county administration, particularly Martha Wapinski and the Burns Institute and the EMC for this report. I know that you have all put a tremendous amount of work into ensuring that the public has multiple opportunities to contribute their input on these critical questions. So just a huge thank you. I was really interested in hearing both presentations and appreciated the emphasis in the report on the specific responses that people gave within the virtual and in-person community engagement sessions about their views for what they would like to see coming from the county and how we can implement alternate approaches to harm and violence different from the presumption of the criminal legal system and incarceration. And I wanted to emphasize particularly what I heard in the comments about from the EMC focus group. What I took from that presentation was that the people who were less engaged with the issue didn't feel that they should have an opinion on whether the county should build a new jail because they're disconnected to the issues and that the questions were beyond the scope of their knowledge and capability, and felt that the county should be asking people who are directly impacted by the issues to provide forward-looking direction. So that said, and of course they did want to see an emphasis on mental health care and rehabilitative services rather than punishment. And to me, the findings are really interesting, and they affirm the necessity of really placing more weight, greater weight on the perspectives of people who are directly impacted by the criminal legal system. And in that lane, I'm looking forward to hearing the full report to the board in October, which of course will include the in-custody component of these sessions. Just a quick question about the in-custody component. Why are they taking place over Zoom?
Because of precautions around COVID.
Got it. Entirely reasonable, thanks. I just want to make a proposal regarding the final report that will come back. Given the conversations that our whole board has been having about alternatives to incarceration and other ways in which the county is being called to fundamentally shift our criminal legal system, the conversations that you're recording are really relevant for purposes beyond the single question of whether the public wants a new jail, and to Supervisor Wasserman's point, or mental health facility, or both, or something else altogether. And given that those responses really carry a much broader analysis and perspectives and suggestions, I'd really like the report that comes back in October to reflect with as much specificity as possible the input of the community responses to each question. Since the community engagement session asked multiple questions, I think it's really important for us to see the participants' responses to each specific question. And I want to make sure that we're not having to repeat work, and that we take this opportunity to really consider this broad feedback and suggestions that were provided by the participants of the engagement sessions. I think the content of these conversations should direct the work we do on all fronts because they're so interrelated, and any changes that we enact really need to be generated from that expressed desire and need. So I'm confident that you are on your way toward building a report that will be really useful to the public and to the Board of Supervisors, and hopefully will continue to be a guidebook as we move forward in whatever direction we end up going. So thank you so much.
If I may, Supervisor Ellenberg.
Please, Benoit.
So I want to respond to Vice Chairperson Mike's comment. I think they're very important because that's one of the main narratives we have in the United States. One of the fundamental questions that our founder, James Bell, asked us and asked the world most of when he's presenting, he's about to retire soon after he writes his book, is how do you find those that are experts at what they do? And so the question that he pushes upon us to be able to be critically engaged with other folks is, where is the safest place in the world? And how do we then look at that safest place in the world and figure out what they're doing that ensures public safety to the greater degree that we are seeking here in the United States, particularly here in Santa Clara County? And so in our research, we found out that the Netherlands are a place that is one of the safest places in the world. I think in 2012, they may have had close to 20 prisoners, and I believe none in 2018. And so the question is, what are they doing? How do we look at their model to see how they're achieving public safety? And when you start just looking at how everything's inextricably related, you look at the healthcare, they have a universal health plan. Now that I believe the annual cap of deductible that an individual pays is, I think, less than $500 US. So all these things are inextricably interconnected. And I believe a lot of these surveys, about the sessions, a lot of these folks are trying to get to that point of how do we look at the underlying cause of incarceration, the root cause of poverty, and figure out how do we, if we're doctors looking at the root cause of a disease, how do we then find a solution that works so that we don't continue to have symptoms or continue to be addressing symptoms? So I think we're having these conversations in Santa Clara County is the hub of innovation, is the hub of the Silicon Valley, of the tech world. And I believe it can continue to be a pioneer in how we deal with harm here in Santa Clara County. How do we hold people? How do we hold institutions accountable? And overall healing by being intentional in taking this time to re-envision, to reimagine public safety as a whole, and not simply compartmentalize things like, what do we do with a vacant lot? So this is a great opportunity for the Burn Institute. We find it working with EMC and with the Chief Executive Office. Martha and Veronica have been great in allowing us to figure out how do we become the pioneers to achieving public safety here in the United States.
Supervisor Wasserman, do you want to respond to Manuel?
I think the goal of making a community safer is a wonderful goal. I think there's many, many, many ways to improve things. The reentry center that we created 6 or 8 years ago and duplicated in Gilroy a 3 years ago has dropped our recidivism rate by about 30%, making us the best in the state of California. So that was one way of going. I think our population in our jails used to be 4,500 people. I think it's down at least half. I would defer to Martha for about where we are there. I think we're definitely headed in the right direction. I don't believe there's, well, I'm sure there's someone. I don't believe there's a large population that says we can't have a jail. And what I want to make sure is that the jail we have is as healthy and accommodating and ADA compliant and seismically safe as can possibly be. And in that new jail, there should be room for people with mental health issues that need to be in jail and people without mental health issues that need to be in jail. But I think what a lot of people misinterpret when they hear me speak is that they think I want a jail to have another jail. I want a jail so that we can do away with Elmwood. I want a jail so that inmates can, a new jail, so that inmates can be in a place that is appropriate, healthy, space, light, and rehabilitative. Rehabilitative? I'm not sure how many T's are in there. That's what I want a new jail for. Elmwood should go, and that land should be used for a mental health facility. And our current new jail is several years old and isn't the greatest. The reason I want a new jail is to give people more room and to provide better services. And it's Manuel, if I look on my screen correctly? Yeah. Manuel or Manuel?
Either way.
Okay, Manuel, I too would love a community and environment with little to no crime. And I think all the things that I've seen the county do the last 11 years has been towards that end. The county, I mean, there are no city jails. A lot of people have said to me, well, you don't hear about these problems in San Jose's jails or Mountain View's jails or Sunnyvale's jails. And I said, that's true. They don't have jails. So we're the ones stuck with this burden. But I think we're headed in the right direction. And we have a lot of great forward-thinking people like you just expressed. What can we do to get better every single day to reduce crime and reduce recidivism and help people rehabilitate and help people never go down the wrong path? I think we should have more schools. There's lots of things that I'm sure you and I could go on and on about, but better education would lead to less crime and better opportunities for people to earn a living without having to commit a crime. But again, this is not the venue for me philosophizing, but I appreciate, Manuel, is the passion that I just heard in your voice. And I think we're all on the same page as to how to reduce crime in Santa Clara County. Thank you.
Supervisor Wasserman, I disagree. I think this is exactly the place to share your ideas, to do it in public and to do it with this group of experts. I think that's one of to me, the largest advantages of the policy committees is that we do get to hash this out. And Manuel, and I want to come back to where I really, really agree with you, Mike, and I want to share some propositions. I was first thinking, Manuel, that, well, the Netherlands can't be a great comparison, but they're much smaller. It's a homogeneous population. They have very little immigration. They have significant social responsibility. And then I thought, well, yes, that's a significant difference. If we're talking about just building a structure but changing nothing, then we will have the same outcomes. And Supervisor Wasserman is correct that we may continue to need this sort of structure. But if we are willing to spend significantly more money on the preventative front end, on paid family leave, on early childhood education, on childcare, on for sure more money into schools and paying teachers better and expanding after school programs and expanding access to mental and behavioral health care from a very young age. We have to change all of those underlying systems in order to get to a place where we're not reliant on a carceral system to just incapacitate people and keep them away from everyone else, when we know that that causes further trauma and we know that they're going to come back out and we have done nothing to advance the ball. So Mike, I'm totally with you on all the things we need to do better. And I would love to see our county, and I cannot possibly miss an opportunity to make a plug for the ARPA funds. We have a big chunk of one-time money that I would love to see us invest in the community in ways that are sustainable and that will build this front end of safer, more enriched, more supportive neighborhoods and communities. So I think we want to get to the same place. I think that there is a pathway to get there, and looking forward to seeing if we can make that work. So now we've both gotten to philosophize a little bit, and if anybody on the committee wants to add anything, now would be a dandy time. And if not, let's go to public comment and see how they would like to opine.
One moment, please, while we get the timer up.
Thanks, Dan.
We currently have 7 individuals wishing to speak. Do you still want to give them 2 minutes?
We're still at 2 minutes. Yeah, I think it's 15 that we take it down to 1.
Okay, the number is currently at 8. Okay.
So let's just hold it for 1 second. If anybody else would like to speak, please pop your name in now so we can be sure to give everyone the same amount of time.
It is currently at 8 speakers, and
let's do it, Dave.
2 minutes. Okay, we'll do 2 minutes. Thank you. One moment, please, while we get the timer up. Our first speaker is Scott Largent. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking. Scott, are you there? Asking you to unmute. Okay, he may not be responding. We'll go to the next speaker. We'll come back to him. Next speaker is Raj Jadaya. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Thank you. Good afternoon, everybody. My name is Raj. I'm with Debug and also part of the Care First Jail Last Coalition. Just wanted to first applaud the consultant firms, Burns Institute, EMC, for their work. And I think it was just so telling that we took 2 very different roads that ultimately led to the same pathway. And I think it was so comprehensive and thoughtful of the county to apply both. We had one stream, which was about people that were more proximate to the issue, giving their input. And then you had another avenue, which were people that were purposefully, objectively outside, so that you have a litmus test of sort of both accounts. And I think what's so striking is both of those approaches led to the same consistent, clear position that we don't want a new jail. And I did want to respond to Supervisor Wasserman's response to that study, which was similar to what he said, I think, at the last board meeting, which was after a number of people spoke up, he had said, well, now we know what the position of the advocacy groups are. I want to hear from other people. Well, you either have an open, honest inquiry of community engagement and democratically follow what those results show, or you don't. And this was an open invitation from the Burns Institute. It was a litmus test of who cared about the issue by who attended. And you can't fault people for having an opinion based on their experience. And as a way to kind of fortify that position, the EMC survey results were purposely blindfolded. So you can't discount the position of people just because it doesn't confirm the opinion that you already have. And if this is going to be a democratic process, I think you follow the results of the community engagement process. And the next step would be to refine the question to not make it about jail or not, but what else should we build instead?
The next speaker is Claire. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, yeah, so I'm one of the community members that was in the engagement session. I also work on the acute psychiatric unit at Main Jail. And I just wanted to point out that this issue of mental health care in jails is naturally connected because 45% of our jail has a serious mental illness. And I work with this population. And I think what people don't appreciate is these are profoundly disabled people that do not belong in jail because they cannot even mentally take in the process of punishment that jail is supposed to impose for the sake of rehabilitation. The vast majority of my clients are there on petty charges. So, you know, there's no capacity issue with jail if we decarcerated 50% of the jail. And I think the concern with building a new jail is that it represents a kind of retrenchment in a failed carceral system. And we do, you know, our resources are not completely unlimited. And so given limited resources, if you give the community a chance to say what they would prefer to see happen, I think what the community is saying is that a new jail is not a priority to them, specifically because it does not make us safer or address the root causes of incarceration. I appreciate Mr. Wasserman's observations that he wants humane conditions at the jail, and I agree with that. But sometimes you have to take a radical step to really shift a process. And I think the community is asking for that radical step now to really move towards decarcerating people and not investing in the carceral system. Thank you so much.
Our next speaker is Melissa. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, my name is Melissa, and I am an impacted family member from Debug and in support of the Care First Jail Last Coalition. I'm speaking on item number 5 and agree with the EMC and Burns Institute preliminary findings that the community has overwhelmingly decided we do not want a new jail. It's time to reimagine the justice system as a whole, address the root causes of incarceration, and have alternatives. We are looking forward to the Burns Institute community engagement process with folks in the county jail. Strongly support someone who is system impacted to help facilitate, and recommended focus groups to also be inclusive of all jail populations and classifications. I also want to add that don't forget that LA County has done this and we can do this too. And I know, like, as the whole US, like, it is a direction of decarceration, mass decarceration, and we should take that step and be an example of what healing really is. There's a reason why people have to go to jail, and so we need to address those root causes of whatever it is that anyone's going through. Thank you for your time.
Next speaker is Leslie Zager. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, I'm Leslie Zeiger. I live in District 5 and I'm a member of Surge at Sacred Heart and the Care First Jail Last Coalition. The findings from both EMC and Burns are clear. The community is overwhelmingly against a new jail, and it's time to radically reimagine the justice system as a whole and increase non-carceral community-based alternatives. To that end, thank you, Supervisor Ellenberg and Supervisor Chavez, even though she's not here, for Tuesday's referral. Today, I want to say we need the supervisors to take these findings from EMC and Burns Institute seriously. They are part of a community engagement process that the board voted for. Supervisor Wasserman, today you dismiss the findings because you disagree with them. And at last month's PSJC, you were dismissive, saying that some people, the same people keep showing up, or other people who aren't here might disagree. Having been at two of the engagement sessions, having shown up at so many public comment times in PSJC meetings, at board meetings, I can tell you that we really care. We are jumping through the hoops to make our voices heard. If there are people with alternative opinions out there, it doesn't seem like they care too much. They don't care enough to jump through all the hoops that we jump through. So you need to listen to the community and commit to definitively stopping construction of the replacement jail and going for non-carceral alternatives. Thank you.
The next speaker is Karen Matsueda. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, good afternoon. This is Karen Matsueda from District 3 in San Jose, also part of Surge at Sacred Heart and the Care First Jail Last Coalition. I'm also the sister of a severely mentally ill man who has been in and out of jails, really because of his illness. So this is a personal issue to me. I participated in 2 of the recent community engagement sessions, which I really appreciated. And I agree with the preliminary findings that what we're overwhelmingly hearing is we don't want a new jail. And with all due respect, if we build a new jail, we will just fill it with more people. It really is. I know we keep saying this, but it's time to reimagine what public safety can look like, what real justice can look like as a whole, and then address the root causes that lead to incarceration and then act on them and provide effective, sustainable alternatives. So we're looking forward to the Burns Institute's community engagement process with people in the jail. And I also want to echo this strong recommendation that a system impacted person help facilitate those meetings and that the focus groups represent all jail populations and classifications. Thank you for your time.
The next speaker is Tina Brown. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon. My name is Tina Brown, and I am a system impacted family member with Silicon Valley Debug. And I'm also a member of the Care First Jail Last Coalition. I am speaking on item number 5 and agree with the EMC and Burns Institute preliminary findings that the community has overwhelmingly decided we do not want a new jail. The time is now and long overdue to reimagine the justice system as a whole, address the root causes of incarceration, and have alternatives. I am also looking forward to the Burns Institute's community engagement process with folks in the county jails, as I believe their words will impact and lead to progressive results. I also strongly support someone who is system impacted to help facilitate and recommend focus groups to also be inclusive of all jail populations and classifications. Thank you very much for your time.
Our next speaker is Cynthia Longs. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hello, my name is Cynthia Longs. I live in San Jose in Supervisory District number 1. I am a systemic impacted family member, a member of the Care First Jail Last Coalition, and a debug advocate. I agree with EMC and the Burns Institute's findings that the community has decided that we do not want a new jail. It is time to reimagine the justice system as a whole. We need to help the mentally ill inside our jails by building a wellness center. We need to address the root cause of incarceration, the root causes of incarceration, and provide alternatives. I'm looking forward to the Burns Institute's community engagement process with the folks in the county jail. That would be my son. My son is in the county jail. I strongly support someone who is in the jail or in the system to help facilitate and recommend the focus groups to include all the jail's population and classifications. The EMC group mentioned that those people who were not close to the problem or were affected wanted the county to make a good decision. A good decision is to not build a county jail, but seek alternatives. Thank you for your time.
Dr. Smith, I see that you have your hand raised. We have one more public speaker. Do you want to speak before that, or can you hang on for another 2 minutes?
Oh, no, I can wait.
Okay, let's have the last public speaker, Dave.
Okay, we're going to try for Scott one more time. Scott, I've unmuted you. You have 2 minutes. Go ahead.
Okay, great. I really appreciate you guys going back to me. I wasn't sure if I was called or not. I get a lot of telephone calls from my daughter, and we're heading over to Starboard Park around 4:30. So, yep, that's when you get off the horn on these meetings. We know what we need, and we know we need we don't need a new jail. We do need a jail, but we don't need to build a new one, and we can't wait around to rebuild a psych ward, put in something new. We have existing buildings right now. We can get creative with it, and the demand is there. I'm wondering what the percentage of the homeless population are mentally ill, are strung out on methamphetamines. I need to get the numbers down solid, but what I'm seeing is when we chase around the homeless and we provide them, well, we don't really provide them services, options, places to go, we're creating a mental health problem. And a lot of them, to cope with things, get on methamphetamines, and the meth that's out there 6 months to a year, they do become crazy. I was one of those. We are going to be doing that right now with what we could call our psych ward that's in a field in front of the airport. When we start to sweep through, which this is gonna happen, it's basically set out there by San Jose. It's just I'm not going to use bad language on here, but I'm just shocked they're going to do this. We're going to go from one section to the other section to the third section to the Santa Clara County Jail. That's what is going to happen. Let's get some boots on the ground and get people out there to help them. And maybe we could farm some stuff out to some rehabs, maybe in different states, maybe down south, just something. I just wish people would get creative with things, because I watch these people getting run over in traffic out there, and the county's not showing up, the city's not showing up, and it's just hard to watch. It really is. Thank you.
That concludes our request to speak.
Thanks so much. Go ahead, Dr. Smith.
I just wanted to comment on the public speakers who mentioned decarceration, and for the Burns Institute and EMC going forward, I wonder if there's some way of putting those issues into the discussion, because decarceration really requires the courts to stop, sentencing people to jail or to remove them from their sentence right now. The board can't affect that reality. So I think there needs to be some way of bringing that conversation forward in order to deal with those concerns that I heard expressed in the public.
Thanks very much. We are going to move on to item 6, and I can't see what it is because my screen just froze. Supervisor Wasserman, can you help me out here?
You betcha. Receive report from the Office of the County Executive, Office of the Sheriff, Technology Service Solutions Department, and Procurement Department relating to the deployment of the Jail Inmate Services Platform Tablet Program.
That's the one. Thank you very much.
Thank you, Supervisors. Gary Hersey again, Deputy County Executive. Along with me today is Dan Baldry from TSS, as well as Sue Clements from TSS, and Captain Sepulveda from the Sheriff's Department. As you recall, this was a referral made at the June 22nd board meeting to provide 90-day updates to the Public Safety and Justice Committee. This is our first update today. Before we get started, I just also wanted to recognize Sue Clements. This is her last day with the county, and she has been the project manager since earlier this year, and actually just championed this project and really got it moving and implemented. So I just want to thank her before we get started for all of her work and wish her well in retirement. And with that, I will turn it over to Dan, who will give you an update on the implementation status. And then we'll go to Captain Sepulveda for an update on the correctional side of the implementation. And then we'll take any questions you may have. Dan?
Good afternoon, supervisors. Can you hear me okay?
Yes.
Thank you. All right, so since we provided our report to the board on June 22nd, staff have been diligently working with the vendor, GTL, to continue the inmate tablet rollout, and I'm pleased to report that we've made substantial progress. I can now report that the tablet rollout in the main jail is considered complete, with a total of 657 tablets deployed for use by inmates across the facility. From this point forward, any change in those tablet accounts at main jail will happen in response to the operational needs of the facility. At the Elmwood complex, 1,279 tablets are deployed, with the remaining 1,000 scheduled for deployment this month, using the charging carts that we recently received from GTL. This will allow us to complete the deployment in September as planned. All told, this will result in nearly 3,000 tablets deployed across both facilities, a number that will then flex according to the operational demands of the jails. Cross-departmental collaboration in this implementation continues to be strong, with positive feedback being received from both inmates and their advocates. And with that, I'd like to now hand off to Captain Sepulveda so we can share more details about tablet content, services, and usage. Over to you, Captain.
Thank you. This is the sheriff first, and then we'll go to Captain Sepulveda. First of all, I really want to thank Sue Clements for everything. She's worked very, very closely with our staff. It's going to be a huge loss to TSS. She was there with us completely as we were doing the rollout, and we're real happy with the progress that we've made. Captain.
Hi, good afternoon, Supervisor Ellenberg and Supervisor Wasserman. So one of the main questions we've received is who has access to the tablets. I just want to reiterate that all inmates were going to have access to tablets once the rollout is complete. That has always been our focus and our goal, and we will maintain that goal. The overall feedback we've received from both staff and inmates is very positive. They're happy with the content, they're happy with the education and the entertainment associated with the tablets. If I can point to our analytics that we have just in the last month for our educational platform, at the Elmwood facility, just the learn-only amount of hours, productive hours, are 8,725 productive hours, with 924 unique users accessing educational content and taking courses. 5,375 hours have been used for accessing other services like entertainment, filing grievances, filing request forms, using it for commissary orders and whatnot. There have been 1,858 courses completed on the tablets at Elmwood. The top courses at Elmwood taken are associated with auto repair, reading, level 2 reading, math, computer skills, inner healing, and carpentry. At the main jail facility, we've had 3,994 learn-only hours with 463 unique users, 1,979 other usage hours, 686 courses completed. Their top usage for courses is auto repair, handling money, finding a job, business law and ethics, and electrical studies. And I stand ready for any questions if you have some.
Thank you. Supervisor Wasserman, go right ahead.
Thank you. I've often made little quips about the tablets and all at the jails, but hearing your report just now shows me this was a good move. Hearing about the courses completed and what type of courses were completed by individuals via their tablets shows me this was a good move. So thank you for that data. That's it for me, Chair.
Thank you so much. I have just wanted to ask a question about the tablets. First of all, let me just back up for a second. Thank you. I'm really, really pleased to see how much of the population has already received deployment. I know that this has been a very, very long time in coming, but that makes it nonetheless exciting. What I was wondering about is, I believe that the public defenders have been using tablets to communicate with their clients. Are there two separate tablet systems or physical tablets? Are they merging, and can people get in touch with their attorneys using the tablets?
Go ahead, Dan or Captain Stopova.
Okay, Captain.
So yeah, they're two different systems. Right now, the current vendor is working on a project. They advise us they're working on a project to actually create a system where an inmate can access information from their attorney into a private hosted cloud where only they can see the data, that the discovery information or whatever that the attorney can provide for them, and have some sort of interaction with them privately. So, but it is two different systems as we speak right now.
And does it make sense to keep them as two different systems? I see Sylvia waving.
Yes.
Yeah.
Yes, it is. It is for now, because of the privacy and confidentiality issues. So the tablets that have been deployed for the defense agencies are strictly for discovery, for document and evidence review, to ensure that the clients have the information they need to make informed decisions and assist counsel. Mm-hmm. And the electronic devices have the capacity to store digital data that we're not able to provide to clients in the past, like recordings and videos and body-worn camera footage, et cetera. So, and then, by the way, the number and volume of discovery that is now being handled is so voluminous that it does require and justify two separate processes and systems. However, in light of what Captain Sepulveda just mentioned, I think Molly Speaks would be interested too. We would love to be part of conversations about what our future looks like, to see if there could be in the future an integrated system that would be less costly for the county, because it is an expensive process that we're currently using. So if there is a cost savings that we could provide for the county in the future, I think that would be a really good and productive conversation to have, where we could ensure sufficient privacy for the attorney-client confidential data, but use a consolidated device. And so that conversation couldn't happen because we have the pressing necessity, given the constitutionally mandated services we provide. We couldn't wait, but now that there is a device out there, that I think the conversation can occur.
Thank you. Molly, do you want to add something?
Yeah, thank you. Just to kind of piggyback on what Sylvia was saying, I think, first of all, to the Sheriff's Department, it's a huge deal that incarcerated individuals now have tablets for all the reasons. We're hearing anecdotally from our clients that it's a game changer for them to have access. And I also have heard from Captain Paget that on the whole, people are happier and therefore kind of causing fewer problems, which would be sort of an obvious expected result. But I think in terms of where we go next, those tablets are great, but they're not any different in terms of communication with the outside than the phone system is. So what would be ideal is for there to be two-way communication, so that the probation officer could call in to any individual person in the jail. The lawyer could call in to, because there's lots of business to be done, and it's very, very difficult to do it. The other thing is, on the other system, not individual tablets, we are able to video conference, but it's pretty clunky, as I think I've mentioned to the board. So as we stood that up, probation and behavioral health and Judge Manley's team wanted to be able to also use the scheduling system to make appointment times with folks in the jail. But it's a really clunky, antiquated scheduling mechanism that a personnel person in our office every night sends an email kind of verifying the schedules. That's so not Silicon Valley. So I know Dan's already working on this, but ideally we get everybody together, figure out how everybody needs to use the system, what's most beneficial to folks in the jail and the services we're trying to provide, and we make that happen.
Thanks. Is that an opportunity for TSS and the public defenders to work together as well?
Mm-hmm.
Yes, and we are.
Partners. Sorry.
Yes, Molly's correct. We already are discussing this as a matter of fact. So
love it. Thank you.
And I do want to echo the compliment to the sheriff and the benefits that we are already hearing across the board about the usage of the tablets and the positive impact it's going to have not only on our clients, but also on the work of the correctional staff, since it is going to be a really incredibly positive behavioral management tool. And so I really want to commend them for all that hard work and dedication to the project, and also to encourage them to reach out to us in providing us information that we can deploy out to the community in terms of the positive attributes that this is creating. Because if we farm out this kind of positive information, again, good news is better than negative news. Negative news travels really fast. Positive news sometimes does not. And I'd be happy to share the positive developments.
Thank you. Thank you.
And Sylvia, that's great feedback. And the report mentions that a survey is going to be conducted to learn about the user experience. And I really look forward to hearing the report on that, with the recognition that ultimately the real success with the tablets and their deployments is whether they are serving the people who are using them in a way that is useful and productive. So yeah, good things all around. It's really nice to hear. Do we have any other comments on that? We'll go to public speakers on item 6.
Okay, we do have one public speaker.
Okay, 2 minutes, please.
The next speaker is Ron Hansen. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you, commissioners or supervisors and county staff. As some of you may know, I've been a long time advocate for getting tablets in the jail. This has been coming up on 6 years when I first talked to the board. And I just want to give my appreciation and thanks to the Sheriff's Office for its diligent work in this, to TSS for their diligent work in this, for the board, of course, and underwriting the cost of this work, and for the county executive in the leadership that they've shown as well. This has been a great success story in my view. I think there are a few things that we need to tinker with, but this could not have happened without the benefits of all of those I have just mentioned. So thank you very much. And I look forward to the future of the tablet. Thank you.
That concludes our public speakers.
Thank you so much. We don't need a vote on this item. It's just to receive a report. So our last item of the day is number 8, quarterly report from the sheriff about grievances.
Go ahead. I'd like to introduce Lieutenant Nguyen on this report.
Good afternoon, Supervisors Ellenberg and Wasserman. The quarterly report on inmate grievances have been submitted. I am ready to present or ready for questions.
I know what my colleague wants.
Mm-hmm.
You want to go right to questions, Supervisor Wasserman?
If that's your wish, Madam Chair.
That's fine. I'm certain we both read the report and it's available to the public, so I'm glad to do that. And do you have questions?
No, ma'am, I do not.
All right, then I do have a few. I was glad to see that the Sheriff's Office is responding to 100% of the grievances that it receives in a timely manner. I'd like to provide some direction for the subsequent quarterly grievance reports. I'd like to see some detail and emphasis on how each grievance is not only responded to in written form back to the person who submits it, but also how the Sheriff's Office is responding kind of on a meta level to the grievances through changing any processes or services or anything else as a result of grievances. I'm really interested in hearing quarterly about the grievances to understand the iterative process of consistent improvement. So is that something that can be accommodated for more specifics on the nature of the grievances, how those are dealt with, and whether they lead to any larger changes?
Great question, Supervisor. We do analyze all of our grievances and where we can find areas that need operational changes or improvements. We do that. So it'll take us some time to go back and look at some of those efforts. One I can point back to at the beginning, I think we reported a few months back, was when somebody was there was a practice of putting the cold milk on the hot trays. The inmates grieved it. We went immediately and changed the operational process of not doing that. So those are kind of the examples, but we can go back and look and see what else we can point to.
Thanks. That's exactly the kind of example. And let's just do it going forward. I don't want you to have to backtrack, but for the next grievance report and further ahead, that kind of detail I think is really really useful. Thank you. Anything from the committee? Any public speakers?
We do have one speaker.
All right.
The next speaker is Ron Hansen. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Excuse me, my screen got messed up here. Good afternoon, supervisors and committee members. First, I am pleased to see that this report now does include population and grievance rate information by facility. That's a good step. Also, every report also shows a chart of grievance appeal disposition with the same implied message. Very few grievance appeals, and of those, virtually everyone is denied. In this report, of the 1,600 grievances filed, just 59 were appealed. The Sheriff's Office asserts that the small number of appeals demonstrates that the grievance disposition system works. However, the tiny number of appeals could also be attributed to an inmate perception that the appeal system is just a waste of their time. If Oakland had access to these records, it might be able to shed more light on the appeal process and either substantiate the sheriff's assertion or disprove it. And lastly, the biannual report on the Sheriff Jail Reforms webpage reports that over the course of since July 2017, somewhere around 31,000 grievances have been filed. Amazingly, in that time, there have been just 71 sustained grievance appeals. 71 out of 31,000 grievances filed. These, 2/3 were attributed to non-sheriff's office agencies, that is, facilities and fleet, commissary, custody, health. And for the last 18 months, while there have been 24 sustained appeals, none of them were attributed to the sheriff's office. One might ask, does the grievance unit have a bias in how it adjudicates grievance appeals? Oakland could be looking at this too, if they had access. So I urge the sheriff, since she is here today, to finally sign the MOU with Oakland. Sunlight, as we all know, is the best disinfectant.
Anyway.
That concludes our public speakers.
Thanks so much. Go ahead, Sheriff. Do you want to respond?
Yes, responding to a public comment, if I may. We in October did sign one. We're pretty close to one now. We're beginning the meet and confer with the unions now on it. Certainly that's a process that's required. When I signed it in October, we had completed the meet and confer. I just want to keep reiterating that because I think there is a big misconception.
And is Michael Giannacco with us today? Because I believe that I agree that there is a big misconception in that response. Is Michael here?
I don't believe that Mr. Giannacco is here, Madam Chair. We're looking for him, but I don't see him.
County Council or anyone else that can just reaffirm where we are with the MOU. As I think our public speaker is exactly right, that we could make have a much deeper and more genuine understanding of the grievance process, how they are addressed and the effectiveness of the address if we had access to those pieces of information. Kavita, can you help us?
So thank you, Supervisor. I am not involved directly in that work, given the ethical wall, separation that we have in doing some of this work. So I don't want to give you inaccurate information. Let me obtain that from my colleague though while we're here.
Okay.
And if I could just add that I think Mr. Hansen's points are well taken. And in particular, if there are indeed misconceptions that are generated, part of the problem is that those misconceptions, that misinformation is precisely what we're trying to avoid. And that in the absence of complete transparency and the reporting out that we are requesting and the data that is requested by this oversight group, we're not going to really be able to have accurate responses. And I think Mr. Hansen's points are well taken in that if we have a grievance procedure and process that is so one-sided, that takes away from any validity at all of having that process at all. And one thing I am curious about is that if the tablets are going to be now measuring or tracking the grievance procedure, and if an inmate can submit the grievances through their tablet, it seems to me that having that sort of digital access is going to make it a lot easier for them to be able to track that information and then be able to provide much more accurate, and not that I'm saying it's not accurate, but it's much more timely data about the precise number of grievances that that were filed and then their appropriate responses. But if you were to analyze the statistics as described by Mr. Hansen, under any circumstance, that would not seem like an unbiased and super reliable process.
Thanks, Sylvia. I am supportive of radical transparency here. And if the grievance system is terrific, let us see the data. Then we don't have miscommunication, misconceptions, different interpretations. OCLEM needs the access, and it's as simple and straightforward as that. Are there any? Oh, we already had Ron. No, we're finished with public comment. I think we do need a vote on this, Supervisor Wasserman, because I gave some direction regarding future quarterly reports.
We do have a couple of folks that have their hands raised.
Got a whole bunch of things going on here. Say that again, Dave.
My apologies. You do have a couple of folks with their hands raised.
Oh, okay. Then,
and the sheriff and Kavita both have their hands raised.
Okay, so let's go to Kavita first, then the sheriff, then our two public speakers.
Thank you. I'll be very quick, and I apologize for not having that information at my fingertips, but I understand that Mr. Janako sent an off-agenda report to the board on August 30th, earlier this week. So the information you were requesting from Mr. Janako should be there in writing.
Thank you very much. Sheriff Smith?
Mm-hmm. I have a lot of faith and confidence in our grievance unit that their information is accurate. In the information sharing agreement from October, it did include having access to the grievances. In the one that we have now, includes access to the grievances. I sure don't want to diminish or question, and I think that any look by OIR will show that our grievance responses and numbers are honestly portrayed. Also, we, to my knowledge, are the only county in the state that posts all the grievance information and numbers online. I am a huge proponent in transparency and will continue to be that way. And I think in this case, we've actually exceeded other counties in this state in how we do it. And Lieutenant Wynn, it does an exceptional job.
Well, I am definitely interested in Santa Clara County and not in other counties. And I'm glad to hear all of the touting of the system and your commitment to transparency. Just give them access. Give them access, and we don't have to go in circles with this conversation. Supervisor Wasserman, did you have anything to add, or you were telling me about the public speakers?
I was telling you about the two county speakers. I was not telling you about any public
County
speakers.
Got it. Okay, let's have the two county speakers, please.
We just heard from Kavita and the sheriff.
Oh, good Lord. All right.
Yeah, to my knowledge,
Thank you.
Dave can tell you, but to my knowledge, I don't believe we have any other speakers.
Okay.
We have no further speakers. My apologies, Madam Chair. That got caught in the crosstalk there. It was just those two.
All
Okay,
right.
perfect. Then let's do a vote on the grievance, this item, because I added further direction looking for more details on future quarterly reports.
For clarity, Madam Chair, can you remind me who made the motion on that, please?
The chair.
Unclear. I'll make it right now.
Thank you.
Second.
All right. Vice Chairperson Wasser
Yes.
and Chairperson Ellenberg.
Yes.
Thank you.
Thank you so much. Item 9 is the space for announcements. Do any of our panelists have an announcement that they would like to share with the group? And Dave or Mike, if you can help me if I miss any hands that are up. If not, we shall adjourn to October 7th at 2 p.m. And thank you so much. Thank you everyone for participating and for really robust conversation today.
Thank you.
Thank
everyone.
you, Chair.
Be safe.
Bye, everybody. Stay safe.
Recording stopped.
Thank you, Madam Chair. We're going to end the
Yes,
meeting.
that's fine. I was
All
just
right.
texting.
Have a good one.